let's start with some numbers on COVID and what am I seeing real numbers wise. And even before that, I want to thank you guys for joining me today. We'll update the trends and research. And I updated my protocol, my COVID-19 protocol for people with vaccines and people without vaccines. And for kids, we thought about kids going back to school and how is this relevant. And I will be answering questions on COVID only right now. On other things, let's hold off. We'll try to get to as many questions as we can. And if you don't get your questions answered, you can ask it on Facebook and Instagram. We'll try to answer it that way. And Roger, great to see you. Roger, I owe you a text. And Melissa, the protocol will be, for the people who signed up for this webinar, will be emailing the protocol to you. And for the people who are watching this on YouTube, there'll be a link below. And so, but, we do say follow us on KanodiaMD on Facebook, Instagram, etc. So the first thought of the day is, what are the numbers, right? What's the actual real data I can find? 6 weeks ago, we were having about 12,000 cases a day. Now we're over 140,000. I'm seeing some days at 200,000, 210,000, or 300,000 a day on some of our peak days right now. So it's going to get potentially to the level of it was at our worst, and if not, surpass it. So think of when the worst was in the wintertime. It was snowing outside, it was crappy weather if you're in Ohio or wherever you're at, and you're locked down, you had your mask, no vaccine. Can other people hear me? I think so, Emily. So, and so these numbers will get higher and higher. Hospitalizations keep going up, and we're at the highest level since February. So thank you guys for saying that you guys can hear me. What's interesting on the hospitalizations is that over 90%, over 95 to 98 are unvaccinated people. And so take it for what it's worth. What's interesting that I have found is that 5 states, at least, if not more, have the highest level of COVID through the whole pandemic, and more states are going to pass their levels. The reason why, and Emma, if you're having trouble, you can hear the YouTube afterwards. The reason why we are having the highest level ever in some areas, and the reason why the concern for the pandemic is that, one, the illness, I am recording this, so yes. And so one of the reasons is that, yes, we don't want people to get sick. The second thing is, are there enough doctors and nurses for us to take care of ourselves with cancer, with heart attacks, with car accidents, etc. And so what we're finding is that answer is no. I found at least 2 states, they've called them the National Guards, Oregon and Tennessee, and many states are not having enough nurses, healthcare recordings, etc. So the reason why this is important is not just for COVID, but for our overall health. And so the Surgeon General Dr. Jerome Adams said this is the worst surge that we've had so far. And we'll come to Delta and how Delta is different. But they're finding for adults, Delta is having more severe symptoms than non-Delta. And we all know that Delta can spread faster or is more contagious than the non-Deltas. And so what's surprising to me, I didn't know this, was that children are getting this at a rate of 12 to 15% of all COVID. And 3 to 4% are getting hospitalized. So this one, Delta, is getting kids and young adults a lot more than the earlier variants. And so our kids are going to have to think about COVID-19, not just adults, as early on. So as the numbers go up, if you say we're at 150,000 cases per day right now, 15%, take any number, 13% of them are kids. And 3 to 4% of them are being hospitalized. And so you are going to be, and you probably have seen in the news where, various kids' ICUs, children's homes, children's hospitals have been full of people with COVID now that are kids. Delta is worse, and Delta is making up probably around 93% of our COVID cases at this point. And so the question here then is going to be what? How about serious cases, vaccinated versus unvaccinated? Let's take people above the age of 60 right now. 900% more serious cases of COVID for people above the age of 60 who are unvaccinated. Unvaccinated, under 60, double, so 100% worse in the serious cases. Not saying you should get vaccinated, you shouldn't get vaccinated. I'm trying to find the real numbers. I try to look for the whole spectrum, from the Mercola to the frontline, critical care to the CDC and everything in between. Trying to say, hey, what are numbers for us to make decisions? One thing interesting is who's at high risk for COVID. And I found it on the CDC website, and I want to go over that list. And thank you for the comment at who's at high risk. And I'll put this link in the chat box also. People can get to this link later or now. But anyone over the age of 65 is at high risk. Keep that simple. Also, if we're in that quote unquote minority groups or the inequality groups that we think of, the ethnic minorities, the people that are in those groups also are at high risk. Now, what medical conditions for adults? Cancer. If you had cancer or have cancer, kidney disease, any lung issues. So COPD, asthma, interstitial lung, cystic fibrosis, pulmonary hypertension. We have a new treatment for this I'm very excited about. It's going to be called poly-MVA inhaled. We'll talk about that when we get to treatments. Brain, dementia, neurologic. And they're saying dementia, Alzheimer's. I would include brain fog. If you're having a lot of brain fog, you're going to be at higher risk because the brains we know are being affected. Our sense of smell and other things are being affected by COVID. So that's another high risk, I think, in a functional medicine standpoint. Diabetes, type 1, type 2. Down syndrome. heart conditions. And so we're thinking of heart, but we think about high blood pressure. What's the optimal high blood pressure? The top number below 115, bottom number below 75. High blood pressure is when the top number is above 140, bottom number is above 85. But all those heart stuff plus high blood pressure, HIV, an immunocompromised state. So if you have an immunocompromised illness, your doctor says you need to worry about that you are immunocompromised. And then though you're at higher risk. Or if you're on steroids, or if you're on any drug, medication that lowers your immune system. Liver disease. But we're thinking about alcohol, but non-alcoholic fatty liver. And one person on this call is, I believe, making new treatments for the non-alcoholic fatty liver. And I would advocate or say that, again, in functional medicine, if you have detox issues, that also puts you at a maybe not high risk, but a moderate risk to getting COVID. This is the big one, overweight or obesity. We don't think about this. So, and if someone on this can put in the chat box a BMI calculator that most people don't realize, if they are overweight or if they are obese, they become high risk for COVID. You're pregnant, sickle cell, current or former smoker. If you had a transplant, solid organ, if you had a stroke or any blood flow issues, any substance abuse, alcohol, drugs, etc. Those are the adult ones. But I found it interesting that the list is pretty large there. I did get a question about breastfeeding of newborns to get the vaccine. So is it safe for someone to breastfeed if they've gotten the vaccine? I think that's Pat's question. My answer is I don't know the data on it, so I don't want to answer that question. Angela, who's speaking about the Nationwide Children's Hospital here in Columbus, they are seeing hospitalizations with COVID, but they're able to manage it, which is great. I would rather the people who are kids on this call or parents who have kids not get to the point of being hospitalized. That's no fun. Now, let's talk about the Delta variant to some degree and COVID overall. Thank you, Emma, for putting that down there about the BMI calculator. I would encourage people who don't know their BMI to figure out their BMI. And are they normal weight, overweight, or obese? It'd be surprising what people find out. Doing Michelle's question now on, is autoimmune disorders like Hashimoto's at high risk? I have not seen data to say that definitively. I've looked and looked. Nothing could say that I would say definitively. It depends on the illness. Like a rheumatoid arthritis, my answer is probably yes. A Hashimoto's, don't know. I would say that from a functional medicine standpoint, that autoimmune, keep it simple, is that your immune system is not balanced. It's attacking something it shouldn't attack, which then leads to other illness. So if someone has an autoimmune illness, their immune system isn't balanced. So whether they're high risk, I don't know if they're, I don't know if we want to change the terminology here, but they're definitely not normal risk. They are definitely higher than the average risk out there. Um, and would I treat myself as high risk if I had Hashimoto's? My answer is yes. About that. Now, let me come now to Delta. I'm gonna hold off on some questions now, and let me talk about Delta. Um, I found this interesting. Why is Delta different? And now how are we going to change how we treat them? How do you change how you treat yourself in your life? So there's a Nature article, one of the most prestigious journals out there for medicine or healthcare, etc., or maybe science, and it does a few ways. Number one, it avoids antibodies. So if someone thinks of the movie, I'm a movie TV buff. If someone thinks of like The Matrix, there's Leo, and I forget which movie it was, but he's like, people are shooting the guns, and the bullets don't hit him. Bullets are antibodies. So our antibodies, this Delta, they're not the bullets are not getting to that virus, the Delta variant. Number two is that when the virus hits the cell, it's called an ACE2 receptor. It keeps holding on to it and it doesn't let go. So it's like you have a leash on you and you can't pull it off, right? So those are a couple ways. And then also our immune system, specifically our T cells of the immune system, is being overworked. Means that if we think of ourselves as a car, we think of a gas gauge, the gas gauge is on E. So all the people that are getting COVID, not all, but many people are getting COVID, it's just a low number. That just they ran out of gas. The immune system said no more. The last part of this is many people have heard of cytokine storm or going too much. Just like how autoimmune, we go to a very high level, that we're overcompensating. Same thing, there's overcompensation of the immune system for a lot of people. So that's too much inflammation. We hear the term inflammation. And so we find that is also a cause, a lot. I'm going to, since we've gone over some of this, I'm going to show you some of our ideas of protocols, and we'll come back and forth on that. Thank you for the compliment, the positive feedback. I'm going to pay you some money on Venmo for that. More compliments, more money you guys get. Just joking. Okay. So, vaccine mandates, that's a can of worms. That's more political. I don't want to get into that. I'm going to stick to the science. Hip to waist ratio, that is a great data point also. I would recommend people checking the waist to hip ratio. That's a good marker next to BMI. The question is, do you recommend people getting the vaccine who are high risk? If so, which one? So I like to take the history of the person and know how they have done with previous vaccines. So if someone has taken vaccines before, hasn't had really bad side effects, the chances are that you won't have a very bad side effect to this one. Now, if someone's had really bad side effects to past vaccines, then you need to talk to the allergist, to your doctor, whoever it is. The data showing the vaccine is helpful. It's very helpful. It's a personal decision, right? One data set I saw was we were worried about kids having side effects, specifically heart inflammation. And in the UK, they're looking at the adults. So I saw one data set that says out of 20 million kids, 300 kids got heart inflammation. So I'm gonna let you guys make that decision. It's way under 1%, what they are for the kids' data. From what we're seeing in our clinic, we are seeing very few of our patients getting severe side effects to COVID vaccines, whether it's the Moderna or Pfizer. Someone asked which one. I would say based on the current data, the Pfizer and the Moderna look like a lot better than Johnson & Johnson. And I'm even seeing more data on the Pfizer than I am on the Moderna. I wouldn't nitpick. The first one I could get was the Moderna, so I got the Moderna. But again, everyone has their own decision. I'm not here to go one way or another. I just want to give you information for you guys to make whatever decision is best for you and your family. So let me just show you a little bit of the protocol that I talked about since it's fresh in our head. And I think you guys can see this. Is that right? Perfect. And I hope it's the right size. Everyone can read it. So when I'm thinking about this now, again, how is Delta affecting us? So the first one is this T cells. You got to have enough immune system to actually work so that your cars aren't out of gas. That's number one. Number two is the antibody support. So I want to make sure that you have the right, I think, bullets, so that the bullets are able then to be able to kill COVID if it sees it. Number three is that leach effect. I want to see if we can make sure that if we do bind it, COVID, that it's not staying on our cells and causing illness. Those are the three we've talked about so far. On this page, I'll talk some more, and then we'll go on. Number next is melatonin. I don't think you guys have seen this data. I talked about it really early on. Cleveland Clinic has shown like a 28% reduction in actually getting COVID if you have melatonin. I'm taking melatonin every night. I'll tell you that right now. And my melatonin levels are normal. And so I'll probably talk about melatonin even with the vaccine prep if we have time. I think that's also really good. And this is, I'm starting with people that are vaccinated first. I'll come to the things that are not vaccinated second. There is great data. There's data, lab data on COVID being stored in the mouth and in the nose, but we pass it more from our breathing, talking. That's why singing early on, they found those people were getting sicker faster, people that were in a choir, or people that were loudspeakers, speak loud. I've been known to speak loud myself, so I'm probably, is what it is. I'm a loudspeaker. So they've actually found that if people use the mouthwashes, it's actually lowering the amount of COVID in the mouth. So this, I think, is very important for people who have kids. So this is because if kids who are not vaccinated, and if you're into the vaccines, how do you protect them? One way to protect them is that you not giving them COVID or passing on because you're with them in that contact area. And let's talk about contact area for a second. What is a quote unquote close contact? That is, you're within 6 feet of someone and you're with them for 15 minutes. So if you're someone at the office and you're in 6 feet distance, like within 6 feet, but you're just passing by, your chances of getting COVID are very low. But you have to be within 6 feet for over 15 minutes is a close contact. And something new we're talking about is called Postbiotics. I love this. The best new thing on the market by far. I'll come back to that here in a minute. There's a question: do these supplements work synergistically? Yes. And yes, if someone just wants one, yes, just get one. But yes, synergistically probably is the best, because the problem is COVID is affecting us in multiple different ways. It's not just one way. Now, let's say that you're unvaccinated. What we're finding is brand new study came out. I love it. It's the largest COVID study out there. It has Harvard, my alma mater, down with Yale, and Stanford, and UK. And they have this app, a COVID app, and they're tracking people. And with the tracking, they asked people, should not do that. They asked people certain things. If they were taking certain supplements, they were asking them if they took omega-3s, probiotics, garlic, a multivitamin, vitamin D, vitamin C, and zinc. This is the first study I have seen that actually shows the supplements work. And they found that a multivitamin, a probiotic, omega-3s, and vitamin C actually decreased getting COVID. It was 18% less, 21% less, 12% less, and 24% less for each of those individual things. But needless to say, if you take that number, it's anywhere between 12 and 25% less getting COVID if you had those things. The things that did not show benefit in their study was vitamin C, zinc, and garlic. So we're updating our protocols based off real data. And I love to see real data. Is it the best study ever? No. But at least it tells me where not to waste my money, and if I did want to do something, where to do something at. So we're saying that people that are vaccinated probably need these things here. The people that are unvaccinated, I recommend the basics plus the more advanced ones. So a multivitamin, vitamin D. So we want the D to actually have two other things, K and vitamin A. I actually found one now that has a vitamin A built in. Vitamin A is lung protective. Great. The probiotic and omega-3s. And this omega-3 is not any regular omega-3. You heard me talk about inflammation. That's the inflammation side of this. The SPM actives are the ones that we get the best results with. So you heard me talk about overactive immune system. That's what this works on. SPM Supremes are not as good, but it is at a cheaper price point. I think what we're going to try to do, and I know this costs money, was that, and the team will help you, that if you buy like a 3-month supply of these, whatever, these 5, you save $50. Same thing is that if you buy these 5, these 4, you save $50 type of thing. And I'll come back to the postbiotics here in a minute, here soon. Kids, looking at the data on kids and seeing what I think would be the most helpful if I was going to do something for kids. I would do a multivitamin, a chewable multivitamin. I would do a probiotic and omega-3. Everything chewable is how I would look at this as the basics. But if your kids have any of the high-risk stuff I mentioned, I would, and if they take pills, I would consider some of these things, especially the mouthwash types of things for kids that are high risk. If you have gut symptoms, we recommend IVs. So if you're having, when I say gut symptoms, you have nausea, you have vomiting, you have bloating, you have diarrhea, constipation, that tells me that you're not digesting and absorbing your nutrients well. So if you're not digesting and absorbing your nutrients well, then it's hard to have a proper immune system. So I would say that what we're doing, we're giving people IVs so that we avoid the gut, get the IVs in the body, especially during the surge. If I had to hypothesize right now, this surge could probably last 2 to 3 months. If I hypothesize, don't know, but that's my hypothesis. If you have autoimmune or you're at high risk, we recommend ozone therapy, and I'll explain that. But the data is pretty resound on it, that ozone is great. So the questions on this so far would be the DHIS for kids, quercetin. I think that's fine. Quercetin is fine too. And yes, the mouthwash can be used on kids too. No problem there. Is it safe to travel on a plane? I mean, that's like a can of worms, right? I think that anything we do has some risk to it. I travel on planes, yes. I'm vaccinated. I take my supplements. I do IVs, etc. So, I think it's a risk tolerance for people, what they feel, what they don't. Let me come off this and give some more data. So would a nasal spray work? Great question. I would say that if you do nasal rinses, not just like an ocean spray, nasal spray. So like a Neomed, Neti Pot. We have one in the office, a functional medicine version that we love, get great results with. Doing that will clean it out, which could lower the contagious rate. We all heard about inflammation, and we all heard about the immune system. I touched upon this in the last webinar, this idea of a postbiotic. Let me say it this way, that we've heard, and I found the data to back it up, that 70 to 80% of our immune system is in our gut. I mean, I thought that was true, but I was like, yes, it says it there. I was like, wow. So 70 to 80% of us healing COVID to some degree is in the gut. And less than 5% of us have a healthy gut based on the data. When I talk to the microbiome or gut doctors, the microbiome, right? We hear the term, maybe like probiotics, some of us have heard. Probiotics are cells in our body, are 70 trillion cells. And our probiotics are 210 trillion. It's 3 to 1. So we're more bacteria than we are cells. Those 210 trillion cells are what dictates our immune system to a large degree. And only 5% of us have a good microbiome or probiotics. So for years, you've been hearing us say prebiotics, probiotics. The problem is if we give people just probiotics, it doesn't make the 1,000 things that needs to have for a healthy microbiome. And so these scientists have now said, well, let's put it into a pill, the 1,000 things that a healthy microbiome should have. And now they're saying it's called a postbiotic. So prebiotic plus a probiotic equals postbiotic. And our results have been astounding with the postbiotic. Because it is, we hear this idea of regenerative medicine, right? So what are we saying? That let's say we have a hole in our tire from a nail. We take the nail out, we put a patch on. That's one way. That's trying to, but you have to replace the patch every week or every month. The postbiotic is giving you a brand new tire. And so what they're finding on the postbiotics is It helps with inflammation, and it's been helping with COVID-19. There's great data now on how healthy your microbiome is, or how much good probiotics you have, dictates how severe your COVID-19 is, and if you get COVID or not. Also, it's dictating if someone becomes a long hauler or not. So I was like, wow. So we have been using it. I'm using it myself for my immune system and for my gut. We're using it a lot for our gut patients. And I'm saying, if I pick my number one new thing, would be the postbiotic called Thenobiotic. And if I had to pick one thing to probably do, it would probably be the Thenobiotic. If all I could do was just one thing overall. So it is a lot more money. And you guys can all see my screen. That's why we put a bonus item. It's $625. A lot of money, not saying it's not, for essentially a 2-month supply. So, so Dustin asks, my answer is yes, Dustin. I think that the postbiotics, we are using it for our long haulers. And the brand that we have, I'm going to write it down. So since it's a hot term, everyone's saying things are postbiotics. Most things, there's only one company that actually sells it. Most people are saying, oh, yeah, if you take sodium potassium butyrate, or if you take this, or you take this, that's a postbiotic. No, you really want what's actually going to make the difference. So that's why you see the bonus item on the vaccinated. And the unvaccinated, we recommend the bonus item there too. That's the future of medicine. You're going to hear that now on, this idea of a postbiotic. So can you take a postbiotic while you're nursing? Yes. And Dustin, I hope that you weren't nursing. That would be bad for the baby. Now, here's just some other data I saw. Whether you believe data or you don't, that's up to you. Is that vaccinated people have the chance of hospitalization and death 2,500% less. And vaccinated people get COVID 800% less. One thing interesting I saw, which is why I think the mouthwash is kind of an interesting study, was that even if you're vaccinated, you may have a chance of giving it to someone else up to 20%, based off of an Israeli study. One scientist I like is Scott Gottlieb, and what he says, and whether you believe it or not, is that this Delta is so significant in terms of how contagious it is that we're all going to get it in one form or another, whether very mild or asymptomatic, depending on vaccine status, or that you will get it and it'll be the worst cold flu of your life, with some people being hospitalized. I think I said this before, but I'll say again, the difference of the Delta is that everyone's getting it, which is different than just the adults or the elderly. There's people as kids, people in their teens, people as adults, and the elderly are all getting it. So this is different than the first 2 or 3 waves, etc. And going back to, I think a point was that they did use postbiotics for COVID-19, and they did shorten the span of COVID symptoms or how much COVID lasts in the body for. So that was kind of cool. Here's some other just points here, and then I'll see if I get to the questions. One thing is about ivermectin. I get a lot of questions on that. So I see pretty good data on ivermectin, which I'm surprised about, but I'm impressed with the data on ivermectin. And I see a lot of countries are using ivermectin. So, my sense is that even some mainstream Wall Street Journal and other things are having positive articles on ivermectin. I take it for what it's worth. Booster shots. The data I am seeing more around Pfizer than Moderna is that the vaccine probably lasts, if you're not immunocompromised, 6 to 8 months in the body at enough of a level. So do I think the boosters are going to come? I do. What's interesting is when people are getting the boosters, again, looking at the Israeli data, that's like I think, very clean data. You look at people above the age of 60, the third shot of a Pfizer decreased their chance of getting COVID by 86% and a severe infection by 92%. So the third shot is probably helping what's early data showing, but it's still very, very new. Let me continue. Talked about that. Let's talk about, I hear about kids and getting vaccines. Is what's going to happen about kids getting vaccines if people are interested in that. There's 3 age groups. They break it down. 5 to 11, 2 to 5, 6 months to 2 years. That's how vaccine research is done. So the 5 to 11, that data should be done by end of August, early September. So definitely having data and then moving forward with that. So I think that's going to be the first group. The next couple of months we'll be hearing more about that. Now the age 2 to 5, we should be hearing it by the end of the year. That data should be in. So the age 2 to 5, we'll probably have something next year for that age group. Let me go into another great study I saw. If people are thinking about getting the vaccine, studies show that taking melatonin before and during and 4 weeks after had a significant benefit on the amount of antibodies that the body was making with the COVID vaccine, or saying that it makes it more effective. So if I was going to get a vaccine, I'd be taking melatonin. In our office, ours is the snooze power. That's the one I like. 2 weeks before and up to 4 weeks afterwards. One new treatment that we're seeing that we love is inhaled poly-MVA. When we try to get nutrients in the body, a couple things have to do. One, you have to absorb it, then it goes into the blood. from the blood has to go into the cell. So if we talked about your gut's not healthy, that's not getting from the blood into the, it's not getting from the absorption in the blood. But then if it goes to blood, it will actually get into the cell, the next step. We find a lot of people, it will not go from getting in the blood into the cell. We're finding that this poly-MBA, it's both a liquid and IVs, helps things get into the cell. So we're using it to people that are tired or fatigued, just to make sure that the nutrients are getting into the cell. We found a new way of doing it inhaled. And so for our people with asthma, people with, bad allergies, lung issues, you know who you are. We're having them do poly-MBAs, and they're saying my cough gets better, my pneumonia symptoms are getting better, yada yada yada. And so as a prevention, if you have any lung issues or significant allergies, we're recommending doing the poly-MBAs inhaled in the office. The best data is doing it once a day for a week, every month. So I'd probably do that during the surge. That's not realistic for many people. So we're also saying just do once a week, every week during the surge. If the surge is lasting 2 or 3 months, then back off, just to protect your lungs further from it. IV nutrients, I think we've gone over that. There's great data on IV nutrients and helping out multiple illnesses. So that's great. I get questions about if you don't take any vaccines, or taking vaccines or anything else I would recommend. My answer is I'd have a pulse ox at home, because the first thing that drops for many people is your oxygen level. So I would get a pulse ox at home yourself. Ozone, great data, 27 studies on it, both on balancing out the immune system. So I like it on the prevention side, once a week. But if you're a long hauler, whatever, there's many countries that now are using ozone in the hospital systems. Italy, Cuba, Turkey, India, Spain, Great Britain, China. And so I am happily surprised at how good ozone does for people, even with inflammation and those other things. If you feel inflamed, I really like ozone. That's what we use it for. Let me go through some of these questions now, and that we have. One question is, do we think that we should get antibody tested more frequently? I think the person means for COVID antibodies. So I guess if you have COVID, if you got COVID infection, do you have the antibodies still to protect you? I think it's good to probably get checked at least at the 6-month mark to make sure that you still have antibodies. If not, then make a decision what you want to do. Don't just assume that once you have COVID, you have antibodies for the rest of your life. Tim asked, do you recommend genetic testing to determine reactivity to vaccines? I've not heard of any genetic testing for vaccines, so I can't answer that. Sean asked a question. If you send your child to school and they are the only one of few who is wearing a mask, is the mask even effective or protective? My answer is yes. That I think that the mask still will protect your son or your child because the number one way of transmitting it is through your mouth. I think the data is resound that the N95 are the best mask. The K95s, K94s are also really good. The cloth masks don't do much at all. And so, so I think that's what we're seeing in terms of masks. Have you heard of athletic greens? I've heard of it. I know Tim Ferriss pushes it, and many other influencers push it. I don't really know how good it is. It's got great marketing. The ones I found the research on, I think we have one in the office that I've taken myself, that other patients take it, and we're getting good research. There's one called, I think ours is the greens or something, and they'll tell you that's the one that we're seeing good results with. Jacob, Gloria asked a question: which vaccine would you recommend for elderly women with Hashimoto's? I would say either the Pfizer or the Moderna. I'm seeing more data on the Pfizer, especially with Israel and other stuff like that. But I think either of those two are fine. Marianne asked a question: if you've had the Delta variant, are you more or less at risk for the Lambda variant? I haven't seen the data on that yet, so I don't want to answer that yet. The Lambda is so new. It is the way I would say it right now is this: Lambda is not even in my thought process right now, so I would not worry about Lambda right now. Let's see the next 3-4 months how this Delta goes. Delta is much more significant than Lambda. Jordan or Emma, is there other questions you think are relevant? I think we got most of the questions. I gave you guys the information I thought was the most relevant that I could find right now that was reliable. I'll throw one more thing about the hydroxychloroquine. I'm trying to look at data all different sides. Even the first line of critical care is saying it's unclear. So I'm just not certain on the hydroxychloroquine as going to be my first treatment line for getting COVID. I appreciate you saying that, Tim. If you can give me your Venmo stuff, I'll definitely Venmo you some things. Same with Angie there. But we are trying to. I guess Becky has a question: is rectal ozone effective? Now everyone wants my money. Now Melissa, now look at this. And so, just joking. I definitely appreciate the feedback. I think rectal is much better than nothing, but I think the IVs, we're getting much better benefits with the IVs and the rectals, much better. I guess Barbara has a thing. You feel confused about boosters, it might be necessary and recommended. So my opinion is that probably at around that 6-month, 8-month mark after you got your vaccine, you probably need a booster. Is what I'm seeing the data show. And when that happens, it's hard to say in the US about the boosters, etc. But that's what the data show. Um, um, Dustin, answer your. We'll make Dustin's question the last question here. If someone's recovering from COVID, is there data showing that like they should get the vaccine? It is fascinating. I didn't believe this until I saw it myself. So you have to wait 90 days after COVID for the vaccine. Um, and so that's number one. They recommend waiting, from what I could see. With that said, the fascinating part was the long haulers. They found that the vaccine probably helped 40% of people that had long haulers. That's shocking to me. I would have never thought that, but that's what the data show. Um, okay, Lana, one last one. What are your thoughts about it? It's a great question. Uh, I don't know that I have the data on that, but if I got the Johnson & Johnson, would I be considering a Pfizer or Moderna? I probably would. Closing. Got some closing points. Thank you for joining us today. This is what we try to do, help as many people as we can find the root cause so that you can take back your life. Everyone who's been on here, we're going to email you the link to the webinar and then also the protocol PDF. So keep an eye out on it. As I mentioned before, we're doing these public webinars so that you can get my thoughts on COVID and health news. Be sure to follow us on Instagram, Facebook, yada yada. If you haven't signed up for our newsletter, please sign up for that on the website. I've been starting to do these 30-second video takes on the biggest topics or things I see that are really cool, like about mushrooms, like that. So we'll be posting those on Facebook and Instagram. I do my best to respond to any of the questions on Facebook, Twitter, Instagram, yada yada. So we'll continue doing that. Thanks again for being on this. It means a lot. It's a lot of work, and we want to make sure that we pass off the right information to you. So from me, from Anup Kanodia, please empower yourself and take back your life. Have a good one, everyone. Bye.